Osteoporosis is a serious health concern that weakens bones. It makes them fragile and more likely to break. This can lead to pain, disability, and loss of independence. The good news is that osteoporosis is often preventable. Understanding this condition is the first step towards protecting your bone health. Many people don't know they have osteoporosis until they break a bone. This is why it's often called a silent disease. This essay will help you understand osteoporosis. We will discuss its causes, symptoms, and treatment. We will also cover ways to prevent this condition. Taking care of your bones is crucial for a healthy and active life. Let's delve into the world of osteoporosis and empower ourselves with knowledge. Imagine a honeycomb. A healthy bone is like a honeycomb that is dense and strong. Osteoporosis makes the honeycomb structure weak and thin. This means the spaces inside the bone get bigger. The bone loses its density and becomes fragile. Our bones are constantly renewing themselves. Old bone breaks down and new bone forms. Osteoporosis occurs when the creation of new bone doesn't keep up with the removal of old bone. This imbalance weakens the bones, making them susceptible to fractures. These fractures are most common in the hip, spine, and wrist. They can happen even with minor falls or bumps. Osteoporosis can significantly impact a person's quality of life, making everyday activities difficult and painful. Understanding the nature of this bone-thinning disease is vital to recognizing the risks and taking preventive measures. Osteoporosis is often called a silent disease because it progresses gradually without noticeable symptoms. Understanding the causes of osteoporosis is crucial for early prevention and intervention. While age is a significant risk factor, several other factors can contribute to the development of this condition. Age. As we age, our bone mass naturally decreases, increasing the risk of osteoporosis. Gender women are more susceptible to osteoporosis than men, especially after menopause due to decreased estrogen levels. Family history. If you have a family history of osteoporosis, you're at a higher risk. Lifestyle choices. Smoking, excessive alcohol consumption, and lack of physical activity can weaken bones. Diet. A diet low in calcium and vitamin D can contribute to osteoporosis. Medical conditions. Certain medical conditions and medications can increase the risk of bone loss. Identifying these risk factors can help you make informed decisions about your bone health. Consulting with your healthcare provider is essential for assessing your individual risk and discussing appropriate preventive measures. Section 4. Silent signals. Recognizing the symptoms. Osteoporosis often progresses silently, without obvious symptoms in its early stages. However, as the condition advances, certain signs and symptoms may indicate weakened bones. Recognizing these subtle clues can prompt early diagnosis and intervention, potentially preventing future complications. Persistent back pain, particularly in the lower back, can be a sign of spinal fractures due to osteoporosis. A gradual loss of height, even an inch or two, can indicate compression fractures in the spine. A hunched or stooped posture may develop as weakened spinal bones lose their ability to support the body's weight. Bones that break easily, even from minor falls or bumps, are a significant warning sign of osteoporosis. It's crucial to remember that these symptoms can also be associated with other medical conditions. If you experience any of these symptoms, consult your doctor for a proper diagnosis and to rule out other potential causes. Section 5. Diagnosis. Unveiling the bone thief. Diagnosing osteoporosis typically involves a simple and painless procedure called a bone mineral density test. This test measures the amount of calcium and other minerals in your bones, providing valuable information about your bone health. The most common bone mineral density test is called a dual energy X-ray absorptiometry scan, or DEXA scan. It uses low-dose X-rays to measure bone density in the hip, spine, or other bones. The results of a DEXA scan are reported as a T-score, which compares your bone density to that of a healthy young adult. A lower T-score indicates lower bone density and a higher risk of fracture. Your doctor will consider your T-score, along with your age, sex, and other risk factors, to determine if you have osteoporosis or if you're at risk of developing it. Early diagnosis is crucial for effective management and prevention of fractures. Section 6. Fighting back, treatment and management. Once osteoporosis is diagnosed, the primary goal of treatment is to slow down or stop bone loss, increase bone density, and reduce the risk of fractures. Treatment typically involves a combination of lifestyle modifications and medications tailored to your individual needs and risk factors. Several medications are available to treat osteoporosis. These medications work by either slowing down bone loss or helping the body build new bone. Making healthy lifestyle changes is also crucial in managing osteoporosis. These changes include quitting smoking, limiting alcohol consumption, and engaging in regular weight-bearing and muscle-strengthening exercises. Since people with osteoporosis are at an increased risk of fractures from falls, fall prevention strategies are essential. This includes removing tripping hazards in the home, using assistive devices like canes or walkers if needed, and improving balance and coordination through exercises like Tai Chi or yoga. Managing osteoporosis is an ongoing process that requires collaboration with your healthcare provider. Regular checkups, bone density monitoring, and medication adherence are crucial for successful treatment and fracture prevention. Section 7. Building strong foundations, prevention strategies. While osteoporosis might seem like an inevitable part of aging, there are many proactive steps you can take to build and maintain strong bones throughout your life. Prevention is always better than cure, and adopting healthy habits early on can significantly reduce your risk of developing this debilitating condition. Consuming a diet rich in calcium is vital for strong bones. Include calcium-rich foods like dairy products, leafy green vegetables, almonds, and fortified foods in your daily diet. Vitamin D helps your body absorb calcium efficiently. Ensure adequate vitamin D intake through sunlight exposure, fatty fish, egg yolks, and fortified foods. Engaging in regular weight-bearing and muscle-strengthening exercises is crucial for bone health. Activities like walking, jogging, dancing, and weight training can help increase bone density and reduce the risk of falls. Avoiding smoking and limiting alcohol consumption are essential for maintaining bone density. These habits can weaken bones and increase the risk of osteoporosis. By incorporating these preventive measures into your daily routine, you can significantly reduce your risk of developing osteoporosis and maintain strong, healthy bones for a lifetime. Remember, building strong foundations for bone health starts today.